Hi, for our assessment comparison analysis, we chose between the VB map and the ABLES. In our group is Alexia Banks, Hannah Bargeron, Lauren Greeley, Rachel Hauk, and Bethany Newton. We will first talk about our client summary. Second will be discussion of assessments. Third will be pros and cons of assessments. And our final will be our next steps. Our client is named David. He is 3 years old. He is a white male and he has an autism diagnosis. For his verbal repertoire, he has one-word commands for less than 5 items, engages in vocal stereopathy, and does not tact.
Let's talk about 2 possible assessments to use with this client, starting with the VB map. VB map, which stands for Verbal Behavior Milestones Assessment and Placement Program, is best suited for early learners as it includes skills of those up to a typically developing 4-year-old. It assesses verbal behavior skills, barriers that could be inhibiting progress, and transition skills. This assessment provides clinicians with placement information in different areas of verbal behavior and gives appropriate goals and programming that can be used in a variety of settings. The second assessment we will discuss is the ABLES, which stands for Assessment of Basic Language and Learning Skills. This assessment looks at several skill areas, including receptive and expressive language, motor skills, daily living skills, and academic skills. Information from this assessment can be used to develop IEP goals and academic goals for kids who are school age. The ABLES can also help clinicians make informed decisions about when clients are ready to transition into the school setting and provide strategies to help in different classroom settings, which will prepare the client for success in the school setting.
There are multiple pros between the 2 assessments. A few pros of the VB map are that they have reliable evidence of their results. It does assess language in a non-invasive manner. It finds specific areas to focus on, and it assesses man skills more effectively, which would be more effective to the current client. It also gives practitioners and technicians supporting skills to assist in development. A few of the pros of the ABLES assessment is that the results can be directly turned towards the intervention. It also allows you to remediate weaknesses as well as build on the strengths. Parents can also use it to better understand the child's strengths and weaknesses. It's good for developing routine and functional skills for the client, and it can also be used repeatedly before the client.
There can be cons for both assessments. Some for VB map are it's a limited age range, it's time consuming, limited to measuring verbal repertoire, it requires training, and there's a lot of materials required to complete. For the ABLES, materials are not provided, it's time consuming, there's an unclear start and stop point, instruments are difficult to use, and some skills not addressed are community, domestic, coping skills, peers relations, and problem behavior.
The VB map assessment uses indirect and direct measurement. Indirect measurement would include a pre-assessment interview with caregivers, teachers, or other stakeholders, whereas direct measurement would include testing observations or timed observations. This could range between 1 to 3 hours to assess the client's skills through various tasks and natural observations. Although different, both measurements would be used in the scoring of the VB map milestones and barriers, and a transition assessment would be used to determine what would be addressed for the client's needs.
The conclusions of the assessment are that David demonstrated significant delays in independent play and leisure skills, social interaction, communication, functional and daily living skills, and challenging behavior that present a health or safety risk to others, or significantly interfere with home and community activities. Some next steps and goals for David for communication and language would be for him to spontaneously emit an average of 20 commands per treatment day for preferred items for 80% of opportunities across 3 consecutive treatment days. For play and leisure, he would be able to sit in a group of 2 or more peers for 3 minutes in the absence of maladaptive behaviors. For social skills, he'll be able to respond to greetings or farewells from adults with 80% accuracy. And for his adaptive skills, David will be able to transition away from preferred activities in the absence of maladaptive behavior for 80% of opportunities.
The VB map and the ABLES both hold pros and cons, as we have discussed in this presentation. In terms of our client David, it makes more sense to use the VB map assessment to develop an appropriate and effective intervention. We chose the VB map assessment for a few reasons. It is more age appropriate for David, as he is 3 years old. We also noticed that David displayed delays of independent play, leisure, communication, functional living, daily living skills, and social skills, which are all addressed in the VB map assessment, especially for children that are David's age. VB map also conducts a transition assessment to determine how the results of David's assessment will be met and directly applied to an intervention.